We're just waiting for the calendar. Good morning, good afternoon, and good night, everyone from every corner around the world. Today we have Dr. Rofanda Bakir, all the way from Cairo, from Egypt, and she's going to be talking about obesity. And happy 4th of July for everyone who's in the US. And we're just reminding everyone to put some broccoli on the barbecue. I'm just going to give a quick introduction to Dr. Bakir, and then we're going to go from there. And this is a very interactive lecture. So everyone who have any questions, please feel free to send us the questions. We'll be negotiating it and talking to Dr. Bakir about it. And as many information and as much information as possible, we're going to be getting out of her. Dr. Rofanda Bakir, she's a graduate from the Faculty of Medicine at Ain University, class of 2003, with excellent honor. She had her master's and medical degree from Faculty of Cairo University. She's a lecturer in pathology in Helwan University. She's a nursing student, former assistant lecturer in National Research Center for 13 years, teaching medical students and postgraduate candidates. She's an instructor in MSA University for the past 5 years for dental students. She assisted in many projects, pharmaceutical, medical, and non-medical candidates regarding histopathology study of their work. She's working on research, serving human health, cure, prophylaxis against variable diseases. And she's, some of her articles won local reward in NRC for being applicable in medical and pharmaceutical fields. She's been attending most of the available training courses and teaching strategies and quality assurance. She followed the NAQAE roles in teaching and examining by students with continuous upgrading of like herself, and methods of apply for reaching the highest achievement and application for her candidates. She had a full course of 30 hours in blended learning format from the Faculty of Medicine in Ain University, lecture notes on my subjects and her subjects and assessment, quizzes, problems-based learning. She knows how to deal with hybrid learning, campus online meeting with student candidates to achieve the best possible outcome benefits. Dr. Bakir, welcome. I think we have some technical problems. Let me see. Hello?
I'm with you.
Dr. Bakir, welcome back. Perfect. So okay. Today's is all about obesity, and today in the United States we're celebrating 4th of July, where there's a lot of barbecue, and so there's going to be a lot of food involved. So so it's a perfect day for us to to get to listen to you. Welcome. We're happy to have you, and I know that you're a great lecturer in obesity and for the Faculty of Medicine. So what are you going to be
just
talking
need you to raise your voice a little bit, please.
What are you going to be talking to us about today? Dr. Bakir, can you hear me?
It's not that much clear, the voice. I'm so sorry. Okay. But I'm going to fix it. Don't worry. I'm going to fix this.
She knows how to deal with hybrid learning, campus online meeting with student candidates to achieve the best possible outcome benefits. Dr. Bakir, welcome.
Thank you. I'm very happy and excited to be with you.
Deal with hybrid learning, campus online meeting with student candidates to achieve the best possible outcome benefits. Dr. Bakir, go ahead. You can start.
Sorry, Joseph, I cannot hear you well. If you can just please repeat it.
You can start. We're ready for it.
Okay, should I start with my discussion? It's okay.
Yes, please.
Okay. Well, it was part of a project working on obesity. Okay. It started to be a very global problem, especially the elder ones, but now we're trying to treat it in young ones. So one of our researchers in this project, it was about 10 different researchers, and the effect of obesity and how to treat it on about different 10 organs. Most of our work was experimental. We work on rats. So my issue or my topic, which I'm going to discuss today, is about the non-alcoholic fatty liver disease caused by consumption of high levels of fat and sugar diet, especially in the age of children and adolescents. How we can manage it, how we can treat it, how we can make a drug which is safe and easy to be used for the kids and the parents as well. So our study was mainly about using nicotinamide, which is vitamin B, and vitamin C, ascorbic acid, in nanoparticles. Um, Most of us are very afraid of using drugs for our kids. We are just not knowing how to deal with it, how the kids are going to deal with it. Giving supplements as well is not that much easy. So in small particles and nanoparticles and in a chewable way or in an easy used way, it can be helpful. Also, this can overcome the nephrotoxicity or the hepatotoxicity of any drug. We all know that most of our drugs are excreted from the body through the kidney or the liver. So this work was aiming to decrease the used particles in a nano form, so we can just take the benefit and minimize as much as we can the hazards or the bad effects. Okay, so we use both of them, the nicotinamide and the ascorbic acid, in nanoparticles. They were launched in a technique so we can have their maximum effects. We gathered groups, 8 groups of rats, 6 or 7 rats per each group. They were about 75 days of the study. We used to give them diet in different quantities and the treatment. Mainly the basic was that it's to be high caloric diet, high fructose diet. Because we all these days, unfortunately, we are not having good habits of feeding. Even our children are not raised well in this portion. We cannot stay away from having sugary things or fast foods or whatever these kinds of things. Besides, there's a genetic background, which is insulin resistance or the ability of the body to get on obesity, the dealing of the body with high carbohydrates or
Hi, everyone. I think we're having just some little connection issues. Dr. Like Bakir is going to be with us in just hopefully a minute or two. I think the internet is a little slow. Give us 1 minute. We're trying to get her back in. I think she's just getting back. Dr. Bakir, can you hear us? Hello?
I'm back again, Joseph. I'm so sorry.
No, it's okay. We're happy to have you back.
No, it's a Middle East problem with the internet. I'm so sorry.
It's all right. It's all right.
Well, so far, I guess I'm gonna continue. We planned this study just to get the most effective amount of nanoparticles, the most effective dose of nicotinamide and ascorbic acid as well, without having the hepatocellular injury or the hepatocellular effect, the bad effect on the liver cells. Okay, this was confirmed by histopathological examination, which is my specialty. I did this part of the work by myself. So just to get to know that this disease, the non-alcoholic liver disease, was rapidly becoming the most common indication for liver transplantation lately, which is a very bad thing and a very, very hazardous issue. So we have to control it as much as we can early as possible in a younger age. So how possibly was this study done, or what was the use? As we said before, I don't know you hear it or not, that we have nutritional factors, insulin resistance, oxidative stress, the lipid glucose metabolism in the body different among children and among persons. And so we have no definitive therapeutic drug for treating this non-alcoholic fatty liver disease. Maybe a sort of diet control and dietary supplements could be useful, but they are not the perfect. That's why we tend to use nicotinamide and vitamin C, even as you know, or have you heard that vitamin C was used in the regimen of coronavirus lately with the zinc, because it's very, very important to increase the integrity of the epithelium to resist the infection by various microorganisms. So ascorbic acid is a very important part of vitamin, in our body. We use also nicotinamide in the nanoforms, both of them. We launched both of them, but it was found by this study, or the group studied, that the nicotinamide is much, much better and have a higher evidence and effectiveness on the hepatic cells in decreasing their levels of enzymatic activity. We, of course, as I said before, I don't know you hear it or not, we collect the rats, we form groups of them having different doses to know the most effective dose. So the study takes about 75 days. All rats were fed by the same feeding, high fat and high glucose or sugar diet. All of these studies, all these studies were subjected to statistical analysis to get the most effective and useful outcome. As we said before, that vitamin C increased the epithelial integrity to resist microorganisms and struggle against injury of the cells. Above all, the vitamin C was found that it is not that much effective in decreasing the fat absorption and the effect of high fat, high sugar diet, but the nicotinamide or the vitamin B was found to be very effective in this nanoparticle. Finally, we found, or before finally, I just want to tell you how we got our results. We collect the samples of blood, we measure the ALT and AST, which are the liver enzymes. We measured also the hepatic triglycerides and total cholesterol of every sample and each group. Afterwards, we came to the conclusion that nicotinamide in a nanoparticle or a nano use is very, very, very effective and useful in decreasing the hazards of fat effects on hepatocytes and the liver. From the data obtained, we conclude that, and we found that it's superior over the ascorbic acid nanoformulation. The nanoparticles at a dose level ranging from 10 to 20 milligrams per kg as a daily supplement is very, very effective and overcoming the hepatocellular counterparts and complications associated with ingestion of high fat, high sugar diet. And from this point, we tried to encourage more studies for this, or even a higher scale on humans, so that we can benefit of it. This was part of my study on obesity. We also did other researches on the effect of high fat, high sugar diet on the brain cells, and its effect was mainly on the hippocampal part of the brain. All of these studies were supported by histopathological studies, which means we saw the cell, we took samples, and we saw the cells. I can share screen with you. This was the effect on the liver. This is a section of a liver. This is the central vein of the liver. Those are the hepatocytes. Most of them are not well. If you don't know, typically the shape of the liver, it's usually hexagonal in shape. This is fibrosis and inflammatory cells all over the liver. The hepatocytes does not look well at all. There is a little bit congestion and dilatation of the central vein. All of this are bad effects or side effects or hazardous effects of high fat, high sugar diet. Also, I can show pictures of the brain as well, brain affection. Just 1 second, I'm gonna share it with you. The brain cells usually, not all of the cortical cells are affected, but most of them are affected, unfortunately. I'm just opening. Even the heart cells were affected. Oof. Again, the internet connection has a problem, so I'm trying to share it. This is a section of a heart cell. This is the heart muscle. This is the heart muscle fibers. There are spaces in between. The intercalated disc are not that well. The nuclei are very peripheral, and this is the effect, or was the effect of the high fat, high sugar diet on the heart as well. This is another part of our paper. We also did some studies about the fertility wise. This is the brain cells. Sorry, I guess I lost it. 1 second. Okay. I'm sharing it. This is the hippocampal area. This is the affection of the brain cells with high fat, high sugar diet. Although there are some diets and some modes of losing weight, like Atkins, if you have heard of it, high fat, high protein diet. It's maybe useful to the brain, but it's not that much effective. It causes depression, causes some changes in the motivations of the patient, some in behavioral affections. So it was found that the Purkinje cells of the hippocampus is highly affected with high fat, high sugar diet. So it is not beneficial at all. On all body organs. This is another section of the cerebellum. Also, the cells are mostly affected. Are you still there?
Yes.
Okay. I guess it was a good, big lunch of medical things and medical uses. Above all, as I said, in conclusion, we found out that nicotinamide in a nano formula and nano particle is a very effective supplement. We can use it later on starting from adolescent and children age, I hope, to overcome and avoid the obesity in the children. We can use it even in middle age to overcome these side effects or the bad side effects for the heart and the brain. For young age, it could be useful to maintain the fertility. We had a very important study on the testicular tissue and the effect of the affection of fertility by high fat, high sugar diets. It was a whole project of 3 years of work, continuous work. I hope it's useful for everyone who can hear us today. The PDF is available for anyone who wants. I can give you the link after our meeting, and I'm welcoming any questions if there are. Thank you so much for listening.
So, Dr. Rofanda, can you hear me?
Thank you so much for listening.
Dr. Bakir, can you hear me?
Yes, I'm with you. I can hear you.
Tell us more about the vitamin C and the ascorbic acids and the value of it for younger children and adults at the same time. This was very interesting for us to get to know more about it.
Okay, both are vitamins. It's vitamin B and vitamin C. So vitamin B is very important for the covering of the nerve cells. Okay, so both are vitamins. It's vitamin B and vitamin C. It's help in covering or building up the covering of the nerves, which is a main important item in the transmission of the nerve impulses, which is responsible for the movement of muscles, the development of organs. Not only blood supply is important for organ to work properly, it needs also nerve supply. That's why if any person having a problem in his nerves, this part is going to be atrophied because he's not using it. It is not having its normal nerve supply. So the vitamin B is one of the basic contents and forms of the covering sheath of the axons or the nerve cells. So it was found that it's very important for this issue. Also, it's important in metabolism. It's found that it interferes with metabolism and help the hepatocytes or the liver cells to overcome any hazardous issues in our food. Although, and it's very important to know that it's high doses is also toxic. So everything in our body to deal with or anything that we ingest, if it's in a higher doses, it's going to be bad. It's going to be hazardous. It's going to be harmful. That's why we tend to seek for the least minimal effective doses of any drug or any supplement or anything that could be ingested just to be helpful, just to take the benefit and give away or pass away the harmful effects. About the vitamin C, it's also very important in keeping the integrity of the epithelium. It means it makes the epithelium more resistible to infection, and that's why we use it in the regimen of something like COVID-19 or the coronavirus. It was found that it's keep our epithelium more safe, more strong to overcome the viral infection, and so this help more in resisting and early curing from this virus, avoid furthermore infection and furthermore affection by the virus. This is about talking about the viruses. I just explaining what's the importance of vitamin B and C as well. Vitamin B is mainly related to the nerves. Vitamin C is mainly related to the epithelium and its integrity and its stability and resistance to hazardous agents, either organisms or whatever, biological, chemical, or physical, even insults. That's all, I guess.
Regarding vitamin B, are you referring to something like vitamin B12 or vitamin B complex, like all of them? Which one is more, how do you see the difference? And if you can tell us more about the difference between them regarding that.
Okay, we have about 12 types. The main types of vitamin B interfering with the nerve formation is vitamin B1, vitamin B6, and vitamin B12. Those three types are called the vitamin B complex, 1, 6, and 12. Those are the most important types of vitamin B, and those are the types that interfere or go on with the formation and the constitution of the myelin sheath, which is important cover of the axons or the nerve cells. Those are the main. Yeah. To be honest, they have to be taken on empty stomach to have the highest level of affection. They must be taken loading dose first, and then ordinary dose, basic dose, for about from 6 weeks to 6 months to be beneficial. Okay.
The histological part of
from 6 weeks to 6 months.
B6 and B12, how do you see the difference between them?
Well, vitamin B12 is mostly important in the formation of the axons over than vitamin B1. But when we use the nicotinamide here, we are not using it as a just a nerve covering. We use it here for hepatoprotection, or to induce or to push more the hepatocytes or the hepatocellular function away from being toxic. So in this study, the vitamin B1 was used as an encouragement for the liver cells to deal with the high fat, high caloric diet by decreasing the triglycerides to deal with the metabolism. Vitamin 12, we use it more in neurological disorders or nerves conditions, if I'm gonna make myself clear.
What about vitamin C in children and the importance of it? Can you tell us more about it?
Well, vitamin C is very important ever since the child can bear it. By the meaning of some children are have a stomach sensitivity a little bit. They are born with a sensitive gastric wall. The lining of their stomach cannot face the ascorbic acid that much. So we are not preferring to use ascorbic acid early. We can use it after about 2 or 3 ages. I mean, by passing the infant age, infant starting after 2 years, from 0 to 2 years, this is an infant. Don't give ascorbic acid in this age, because this still, the stomach wall is still weak. After the infant, after being a child, you can give ascorbic acid in reasonable doses, not over empty stomach, just to protect the gastric wall and the gastric juice, because it's also acidic. Both pHs are acidic, so don't increase the acidity for a young child. You can give it in reasonable amounts, 2 to 3 hours after meals, as an orange juice, as a lemon juice, even as tablets. So to increase the integrity of the respiratory epithelium, the mucous membrane, the areas or the entrance where a child can be infected. Most of our infections or the children infections is droplet infection through the mouth and the nose. So if you increase the integrity of this epithelium, the respiratory epithelium or the mucous membrane, so you can make it more beneficial or more useful for a child to increase his ability to resist the presence of infection before even it happened.
I've heard you saying something about even with the COVID.
Ability to resist the presence of infection.
I've heard you saying something about like vitamin C with the COVID as well. It helped with the resiliency of the epithelium from catching the virus as well. Is that what you were saying?
Yes, it was found that vitamin C in the regimen of COVID-19 and the protocol of treatment was found to be a little bit important in increasing the integrity of the respiratory epithelium lining upper and lower respiratory tracts to face the virus and to resist its bad affection. Although we don't know, and there is a personal variability, huge personal variability in the outcome of the virus in different persons, even among males and females, which we don't know exactly what is the reason, but it was found that the presence of vitamin C and zinc as well, which is a trace element, both of them can resist and help the integrity of the epithelium to be more, to make it like a block against the virus, to avoid even the bad effect of the virus and the virus replication inside our cells. Yes. The virus, to avoid even the bad effect of the virus and the virus replication inside.
Other than vitamin B and vitamin C, what other vitamins or things with obesity that you would recommend as well to be included? If you can tell us more.
To be used in case of obesity or COVID?
No, in general, that will help to avoid obesity.
To be used in case of obesity or? Okay, in general, as we said, multivitamin B, vitamin 1, B6, B12 is very important for our nerve cells. It could be used for those who are athletes or for women beyond 35 years of age. This was gonna help them for the less sense of pain, the wear and tear of the bones. It's gonna be assisting the lifestyle after this age, especially that, in the Middle East, we are not that much caring of our physical fitness. So push more to supplements that can help us more to go on with our lives. Also, as we said, zinc is very important. Was used in COVID, and as well as it could be used to resist and to increase the rate of healings. If this person is liable to injury, it helps healing cells more easily. It helps wound healing more easily and more rapidly and more efficiently. Also, for those who care for long hair and healthy hair, zinc is very important trace element for hair. I'm so sorry, I didn't mean to.
I'll be looking for.
You look so handsome in this way, don't worry. I'm so sorry.
So today is 4th of July in America, and it's Independence Day, and everyone will be barbecuing the whole day, and family are meeting and friends are meeting. And what do you recommend people throwing on the grill there today that will be healthy enough to mix with the hot dogs and the meat that everyone is going to be eating? So tell us some recommendations. That's a perfect day for 4th of July and perfect lecture for it. So give us some ideas. What will you
well, happy Independence Day. First of all, and congrats for all the Americans. I guess first we have to stay in open airs to avoid as much as we can the contact. Grilled thing is a very nice to have, I guess. It's very healthy as well, but you have to drink much water with it to stay away from the fumes as much as you can, because it's irritating to the respiratory epithelium. Mucous membranes as a whole. You can drink afterwards a lemon juice or something so it can decrease the feeling of thirst from one side and help in the absorption of protein from the other side, because protein, it takes a longer time with its digestion. Avoid carbohydrates today, so it's gonna be a healthy day, not just Independence Day. It's gonna be very nice.
So lemon juice, America, did you hear that? And with the lemon juice, some water, and what else? Hello? Dr. Bakir, can you hear us? I think we have a little bit of a lag for the internet connection. Just we're giving Dr. Bakir a few more minutes to get back and reconnecting again. Um, let's see. Okay, so happy 4th of July for everyone in the United States. Enjoy your day. We're waiting for Dr. Bakir to get on again. I hope everyone is having a good time with their family and friends and celebrating our Independence Day. Dr. Bakir's lecture today was all about obesity and what can we include in our diet as well, just to help for that. She talked a lot about vitamin B1, 6, and 12, especially, and vitamin C. She uh, was recommending lemon juice with for today as well, and we're waiting for her to give us the rest of the menu for today. So give her just a few more minutes, and she's gonna be back on. Just a little technical difficulties from the internet. Thank you everyone for listening today, and I hope you enjoyed the lecture. It's a little different than what we're used to, and we like having all this kind of diverse lectures and ideas and thoughts and everything. Dr. Bakir, thank you very much if you can hear us. Um, Thank you very much, everyone. Enjoy your 4th of July. And from every corner around the world, have good morning, good evening, and good night. Thank you.